Hey family, MP Tiff here, just coming on today so that we can have our yearly discussion on our heart health. Today's discussion is going to be on, hold on a second. Hey family, how are you? NP Tiffany here today, just jumping on for our yearly discussion on our heart health. Our presentation today is From My Heart to Yours, presented by Element Family Health Practice and Renewed Element Health Compass. Um, as we know, the month of February is Heart Health Month. American Heart Association dedicates this time to discussing why heart health matters. Usually we hear go red for heart health or against heart disease, and this is the month that we normally observe these things. Now, the reason why we're discussing our heart health is because, just for a little bit of a background, heart disease is the number one cause of death in the United States. It's one in three in cardiovascular disease, and it can be preventable in some cases. What we find nowadays is that we see more and more of our Black and brown um, folks coming in later stages of heart diseases when regular lifestyle modification, things such as diet and exercise, no longer is effective, and to the point that medical management or medications no longer work. These patients end up getting very sick, and there's not much that can be done. Um, at that time when we do end up seeing these patients come in. So really what we are looking to do is to have a more preventative stance in taking care of our patients, getting to folks early, having them going to their doctors for screenings at an earlier state, so that we don't end up having the chronic conditions that we have later on in the game, um, things such as like hypertensive heart disease or chronic kidney disease, all result from untreated conditions that could have been um, identified early and managed. They call heart disease the silent killer because it develops slowly. Usually the symptoms are not evident in the beginning, but later on in the game, like I said, we start seeing the effects of it, and when it's usually too late. So why do we focus on heart health so much? Your heart pumps blood throughout your body. It's a major pump in your body. It deals with all of the circulation. It deals with oxygenation of all of your organs. It helps remove waste, and that's your lifeline. That's your life pump. That's the reason why we focus on heart health, because if your heart fails, all of your other systems are affected. Um, and sometimes in later stages, it can ultimately result in death. Our goal is to make sure that we identify early, prevent chronic side effects from untreated conditions, and to prolong and have a healthy life. So, what are our risk factors? So, major risk factors for heart disease. Things that they call non-modifiable are things that are like genetic, things that we cannot change in our makeup, our age, our family history, genetics, all of those things we have no effect on, but things that we can address, that are risk factors. If we have high blood pressure or family history of high blood pressure, those things can be addressed and identified early on. If you're diabetic or your family has history of diabetes, um, we do things early on, like checking our blood sugars when we go to the doctor, checking our lab values, such as A1C levels, which I'm going to get into later on, um, to see where we're at so that we can maintain a healthy level of glucose in the body. Obesity, this is basically our weight. Um, are we overweight? Are we underweight? Things that are modifiable. Smoking, things that habits that we pick up, things that we can stop doing, that affect our health, our breathing, and our circulation. High cholesterol, those things are also modifiable. Exercise, diet, all of those things can affect your cholesterol levels. Inactivity, meaning we're not exercising as much as we should, something that we have control over. And stress. Stress may not be as modifiable as we think, but doing the best that we can to decrease things that are considered stressors, that make us anxious, that increase our blood pressure, etc. Lifestyle, poor diet, excess alcohol use, smoking, like I mentioned before, those are modifiable risk factors. But again, things that we have out of our control is our genetic makeup, our family history, and our age. So what are some warning signs of heart disease? Some of it starts really, really simple. So we may feel more fatigue, more dizziness and tiredness, which may not be uncommon depending on our lifestyle, our fast pace that we're going, our jobs, etc. If you're a mom, juggling life, job, work, children, home, etc. Um, Shortness of breath, that might be walking up like a flight of steps or two flights of steps and feeling more winded than you did before, or walking 2 or 3 city blocks and getting out of breath and needing to stop and take a break. Chest pain or pressure in the chest. Women normally present a little differently. They present with more GI symptoms, nausea, sometimes vomiting, pain in the jaw and in the back. All of those things may lead to what we call a heart attack. A heart attack is when the blood flow is impeded in the heart, the arteries, the veins, and in the structure. There's a blockage causing pressure and pain because the blood is not flowing how it's supposed to. So a blockage may end up being like a blood clot or increased cholesterol, making the vessels more narrow and causing poor blood flow. All of those things will cause increased high blood pressure. Increased high blood pressure can result in damage of the blood vessels and increased risk of heart disease. So, of course, if we have high blood pressure, the ideal is to have it treated. Often, sometimes we're placed on medications if regular diet and exercise is not effective. If you have constant high blood pressure, it puts you at a higher risk for a stroke as well, in addition to having heart attack, etc. Goal blood pressure, according to American Heart Association, is BP less than 120 over 80 is normal. Anything over that is usually considered increased blood pressure. Um, if it's consistently high, over 120 over 80, and it continues to climb, there's a staging range that I'll discuss a little later on about your blood pressure stage. So elevated blood pressure, the systolic number, which is the top number in your blood pressure, usually is 120 to 129. And we want the bottom number, the diastolic number, to be less than 80. That's elevated blood pressure. In a patient with that type of blood pressure, we may just watch it. Medication may not be indicated at this point, as the blood pressure may fluctuate with mood, activity, diet, etc. Stage one hypertension is if you're climbing into that 130, 139 range, and the bottom number or the diastolic number is now in the 80s. Again, this type of blood pressure may be something that we're watching. Lifestyle modification may be indicated. However, if a patient comes in and they have other conditions in addition to just having the hypertension, like they're hypertensive and they're diabetic, etc., we may start them on low dose medication just to see if we can keep that blood pressure under control to avoid any complications later on or any damage of the heart muscles and the circulatory system. Stage two hypertension is high blood pressure. Stage two hypertension, we're usually in the 140 range to 90 range. Usually patients in this range, they may have consistent blood pressures in these values. These patients are going to be placed on medication, most definitely. If you're higher than that and you meet the criteria for severe hypertension, you will be on more than one medication, more than likely. Some of the medications that you may be placed on may be to not only protect your heart muscle, but to protect your kidney function. And later in the game, which is a chronic or critical range, if you're higher than 180 and the diastolic is above 120, this is where what we call a hypertensive emergency. This is where we need to be activating 911. I would say in any range between severe hypertension and hypertensive emergency that a higher level of care needs to be sought out. These patients may not respond well just to medications like oral medications that we normally get prescribed by the doctor. They may need to have medications that are given in an IV to help bring down that blood pressure faster, because in this state, the patient can have a stroke, the patient can have a heart attack, and the goal is to prevent these things from happening. Diabetes. And the reason why we're going to discuss diabetes for a little bit is that diabetes and heart disease tends to go together, and it causes an increased risk for heart attack if a patient is diabetic and has chronic hypertension. Actually 2 to 4 times higher. So the goal here is to make sure that we're controlling glucose levels in patients, again, to prevent damage, to prevent preserve organ function, and to make sure that we are having the best optimal state in order for our kidneys to work, in order for our heart to pump how it's supposed to pump, and for our blood to flow how it's supposed to flow. Patients that are diabetic, we look at two values with them. We're looking at what we call a finger stick value, and that is telling us what the glucose level is now. And usually we're looking for a normal range between 60 to 120. Anything higher than that is we're in diabetic territory, right? And we're also looking at the hemoglobin A1C, which is a blood test that your doctor will take. And the blood test is what's going to tell us what your glucose control was over the past 90 days or past 3 months. So a normal blood glucose level is less than 5.7. When you're in the pre-diabetic range, it's from 5.7 to 6.4. Diabetes is diagnosed after we've gotten a 6.5 hemoglobin A1C level or higher. Sometimes we have patients that have A1C levels that are in double digits. When those patients have blood glucose levels that high, they are at higher risk for heart disease and high blood pressure and other organ failure, complications in vision, loss of vision, complications in the way that they feel, or what they call neuropathies in the microvasculature of the feet, um, and complications with the kidney function. So all of those things are going to be monitored by the patient's doctor. Um, the patient may end up being on either oral medication or injectable medication, most common insulin, in order to manage the glucose levels and bring them down to a range where it's no longer critical and we're not in the danger zone of having organ damage. So what can we do? The whole goal of this presentation is for us to figure out what we can do to help us um, live healthier and to prevent us from getting to the stage where we are now trying to preserve function of what we have remaining of our heart function or of our kidney function, etc. So the first line of defense is our lifestyle and our habits. So, eating healthy as much as we can, eating fresh fruits and vegetables and whole grains as much as we can, lean proteins and meats, things that we consider healthy fats, like things like fish, that have like the omega-3s that are protective, exercise, seeing if we can get out, maybe walk a couple of times a week, to get our heart pumping. That also helps with bringing down our cholesterol, and maintaining a healthy weight, managing our stress, all of those things that affect our heart function, our blood pressures, um, are things that we need to be looking at or looking into to do. Harmful habits, looking into ways to stop smoking. Smoking is proven to be one of those habits that causes um, the blood vessels to kind of constrict and narrow, preventing um, oxygenation from happening or oxygen to flow to the organs through your blood. It also prevents good circulation around the body of the blood because the vessels become small and narrow because of the nicotine. So advising anyone who smokes to stop smoking um, is a good thing to help them later on. Limit alcohol intake, reduce salt and processed foods, which can cause the blood pressure to increase. Avoid sugary beverages, can be self-explanatory. And just eating a clean diet as much as possible. Diet um, with the least amount of processed foods is helpful. Knowing your numbers. So blood pressure, blood sugar, A1C levels, your cholesterol levels, and your weight is very important. All of those things put together create the picture of what health should be. So keeping your blood pressure within that 120 over 80 range or lower, if possible, is great. Keeping that A1C level below the 5.7 range, making sure our cholesterol levels are low, keeping our weight in a healthy range for your height, because that varies according to your height, um, and keeping a good BMI level. So prevention is power. Make sure that you're checking in with your doctors. Make sure that you're doing what you need to do at home. Taking your medications as prescribed if you do end up on medications to treat your hypertension or your diabetes, your cholesterol, etc. continue monitoring these conditions. So making sure that we're going to the doctor and having these blood works done to make sure that the levels are approaching or at range that they're supposed to be at. Making small, sustainable lifestyle changes. So um, things that can help you maybe like handle stress a little better, adding some exercise into your daily routine, um, parking a couple of blocks away from where you have to be, your destination, so that you can get more exercise in and walking, all of those things. And self-care, making sure that you're sleeping adequately and getting enough sleep also is very good in preventing us escalating to heart disease. So this is just to reiterate what I said, walking 30 minutes a day, eating your fruits and vegetables, checking your blood pressure. If you have a home monitor at home, making sure that you're checking daily if you could, especially if you're on medications, scheduling yearly health screenings, um, every 6 months if you do have some values that are out of range, to get that blood work done. And small steps create lasting change. So, small steps is what's really going to help you maintain um, those healthy habits that you have. Um, Getting an accountability buddy sometimes is helpful to have someone to just check in on you while you're going through your process to be a healthier you is also very, very beneficial. Making sure that you are comfortable with your providers and that you're checking in with them frequently. Your providers will know when to escalate, will know what advice to give you about maintaining your health. Um, so making sure that you check in with them frequently is really, really important. So advisable every year, you should be having routine checks, screenings, maybe a EKG done just to make sure that there's no underlying arrhythmias that are happening that can potentially cause an issue later on. Knowing what signs and symptoms to report if they do occur. So again, just to reiterate, if someone is at the stage where they are now approaching or having a heart attack, making sure that we activate 911 as soon as the person complains of chest pain, sometimes chest pain with radiation down the left arm, chest pain with excessive pain in the back, um, uh, shortness of breath when walking or just in general when at rest is also something that is an indicator. Um, Loss of consciousness, etc. And making sure that we activate early if we identify those signs and symptoms. Nausea and vomiting in females normally occurs when they are having a heart attack, and that jaw and back pain, dizziness and fatigue, all of these things, and the pressure in the chest. Make sure that we know that if these things are happening, that 911 needs to be activated as soon as possible because time equals muscle. The more time that we take to activate uh, emergency response, if a patient is having a heart attack or issue of this such, um, causes more damage to the heart and less time that the provider will have in order to rectify the situation, whether it needs surgical intervention or whatever, to remove the blockage that may be causing the issue. So I will leave you guys with this. Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. The whole point of having these small talks on different health topics is just to make sure that we are aware of things that we need to look out for and that we can make sure that we are living the healthiest life that we can and the most prosperous life that we can. So with that, that's the end of this presentation. If you have any questions or concern, you can always reach out to me. This is our Instagram here. Um, Feel free to call or check our website. Um, and let us know what you think, or if there's any other topics that you think that we should be working on to present. So thank you for joining and wish you all good health and wish you good night.